You're listening to the ATS Breathe Easy podcast, brought to you by the American Thoracic Society.
Hello and welcome. You are listening to the ATS Breathe Easy podcast with me, your host, Dr. Eddie Qian, also the host of the ICU and Toddcast. Each Tuesday, the ATS will welcome guests who will share the latest news in pulmonary critical care and sleep medicine. Whether you're a patient advocate, or healthcare professional, the ATS Breathe Easy podcast is for you. Joining me today is Dr. David Gozal and Dr. Shafazand, who will discuss the ATS AI Taskforce and some recent things coming up for the ATS conference for people to get involved. Dr. Gozal is a pediatric pulmonologist and a world-renowned pediatric sleep expert who is currently the dean of the Joan C. Edwards School of Medicine at Vanderbilt University and actually a past president of the American Thoracic Society. Dr. Shafazand is a professor of pulmonary critical care and sleep medicine at the University of Miami, director of their MD PhD program, and the director of the Office of AI Medical Education at the University of Miami, in addition to chairing a number of committees, including this task force for the American Thoracic Society. So welcome to both of y'all. It seems like you guys have a lot of experience and a lot of things to talk about in this space.
Thanks for having us.
I think the thing for me when I was first looking at this and looking at the materials to prepare for this episode was just a very general question. We're here to talk about the ATS AI Taskforce. What is this task force, and what really drove the ATS to try to prioritize having a voice in this space?
Well, maybe I'll tackle the beginning, and then Shirin, Dr. Shafazand, will follow through with some more extensive details. But the important thing is we are a society that is meant to serve the membership in the best possible way through its three major domains, and of course the community domain as the fourth domain. So one is education, one is research, and one is clinical. And in all of those domains, we have seen extraordinary propulsion of AI taking huge steps into incorporating itself into the fabric of almost everything that we do. And we will be almost remiss as ATS, as the world leading organization in respiratory medicine, in critical care medicine, and in sleep medicine. We would be remiss if we didn't have, one, a better understanding of the needs of the membership regarding AI, and so how to best serve those. Two, how to best incorporate AI into the fabric of ATS by providing innovation and fostering collaboration and projects that may lead to novel discoveries and novel ways of educating or of providing clinical service to our patients. And three, how to also incorporate AI into many of the activities that AI has. For example, B-Corps is one example. We're very proud of B-Corps and its time of service promoting epidemiology and training in epidemiology. But at the same time, we have all these wonderful projects that lead to consensus statements and guidelines and so on. These are opportunistic events that lead to the use of AI. So you can see where AI will almost become an integral part, certainly in the moving years, an integral part of everything that we do at ATS. So we need to mark a time that we get the first step into foray into this area. And one, by doing this as a task force, we are doing two things. One, we're listening to what the members want, because that's the most important thing. That's why we have a society. And two, we provide them an exposure as to what is currently in place, that by doing that, inform them of opportunities and initiatives that they could foster through their assemblies or through any other mechanism that the ATS provides. Shirin, would you like to add on to what I just said?
Absolutely. And I think one of the roles of the task force is to also bring about a sense of coordination of all the activities that are going on. Many of our members are already maybe engaged in using AI tools in their clinical arenas and research and education. And for ATS to have this role as a society to bring members together and to sort of coordinate across the various pillars and the platforms to ensure that we deliver like a consistent message, I think, from our society and for our members, and to provide them opportunities to engage even more so in the society. And I think the task force role is to look across the mission statements of ATS and to really think through how AI tools can not only be incorporated into our society, into how we practice pulmonary and critical care and sleep, but also in some ways, ATS has always served as a guide where members can go to for questions around how do other people do things, or what do we as a society think about doing something. And so eventually thinking through governance, thinking how these tools come into the health system. ATS may or may not want to play an active role in it, but as a task force, it's important to think through these concepts along with expertise from our various members and reflect that to the board, and then decide as a society where our positioning should be with respect to a very rapidly developing field. So there's no one person that can keep up with everything that's happening in the world of AI. And we really do need a society, like we do need American Thoracic Society to be one of the key leaders in this field.
Yeah, and there's one thing I was going to comment is it seems like this task force is very wide-reaching and very daunting. So I'm glad we have such accomplished people leading this task force to kind of lead us into the future there. On this podcast, even before this, we've talked a lot about AI and some of the nuances, and AI can include LLMs or large language models, NLP, natural language processing. We've talked about machine learning models. Is there a focus or a line that you all are drawing as far as this AI task force, or is this going to be still just, again, you need a whole committee because we're going to cover everything?
Well, we need a whole committee. It's not that we're covering everything in the sense that we are not going to be reinventing the wheel. We're not going to be directing tasks on, let's do this machine learning project, or although somewhere down in the future, it may be necessary to do clinical guidelines around machine learning, and ATS does need to have a say in that. But I think what is really important as a task force is to identify the needs of our membership and to see where ATS can use its collective might, if you will, to try and meet those needs. And that's where the task force becomes important. We do have a wide range. Within the task force, we now have subcommittees, a group of individuals who have expertise and interests in education, which would then be looking at these AI tools and thinking through implementation and perhaps guidelines and guidance from ATS about some of these tools. Educating the membership about the use of these tools in the realm of education, educating our fellows in the next generation. There are people who clearly, as you said, are using it for machine learning purposes, have been doing it for a long time. So while the public thinks of AI as just happening in 2022, when ChatGPT came on the field, the reality is machine learning has been around for a very long time. And so that expertise, though, while they will continue to do their research, maybe their role in ATS is going to be conveying how to evaluate and critically appraise machine learning products and predictive analytic tools as they become more and more used in our health system. So how can we evaluate the effectiveness of these products? And ATS, in my opinion, should have a role in providing guidance to perhaps health systems that may not have access to all the information and all the expertise. So there's a lot that we can do as a society. And part of the role of this task force is to think through the gaps in knowledge, or the gaps that are needed that we should be addressing in ATS. And we can't address everything, as you mentioned. There's just too much.
So another aspect, Dr. Qian, that I would like to point out, and maybe it reflects the very unique speed at which things are happening, is the fact that most patients today consult AI before they come to a physician. And we need to, therefore, not only to prepare the workforce, our communities of pulmonologists, intensivists, and so on, and sleep physicians to those facts, and to be ready on how to address those elements, but also to educate our patients, particularly our specific patients suffering from the diseases that we take care of how to best navigate through an environment that is all the time under modification, is undergoing changes all the time, and that can be very disorienting for an individual that may not necessarily have the information at the tip of their hands or at the tip of their computer to be able, or the experience to really critically assess the evidence as it is presented. And that too becomes important as we interface with other partners, whether it is other agencies, whether we interface with other associations and collaborate around the world. We are an international society that covers the world. And there are many of our fellow societies around the world with whom we have very significant contacts that may actually benefit from one of us, the ATS in particular, taking a lead on this area and start facilitating engagements with other societies to create a more homogeneous approach to the diseases that we take care of, both in all the three domains that Dr. Shafazand alluded to, but also in the interactions with patients in the more in a wider sense.
I'm excited to introduce a new benefit. ATS Now is a multimedia platform that's AI-driven and allows you to search ATS content for what you need to learn about and know more, whether it's ATS conference material or webinars, etc. It's really tailored to your needs and when you need them. It's like Netflix for pulmonologists.
This is all very exciting. And I know I definitely do want to get to some of the things that the task force already has planned in the upcoming conference and beyond. But, I'd be quite remiss. Both of you all have such vast experience already in this field, and maybe not speaking on behalf of the task force, but maybe as individuals, what kind of questions or what kind of topics do you think are important for us to be addressing moving forward, since as we've talked about that this is such a broad field?
That's a tough one. It's an easy one and a tough one. I think you need more than an hour to talk about topics, but I can at least try and address it from my perspective. In AI and medical education, I primarily am engaged in undergraduate medical education, but also, of course, in GME and CME activities. And the immediate need that comes to mind is, as much as I like to believe that everyone is spending the entire existence thinking about AI topics and learning about AI tools, that is not the case. So the immediate need actually is, in many ways, training the workforce, but also training our faculty and people who interact with our students, whether at the undergraduate or the GME level, because many times our students are actually ahead of the faculty in their use, maybe not quite they use it readily, but whether or not they use it with a critical thinking angle is to be debated at times. But that's okay, because the role of all of us is to educate ourselves about these tools, when to use it, when not to use it, the ethical limitations, the regulatory limitations, and then be a voice within our health systems, because ultimately clinicians are working with these tools and they should be the ones directing its use, and they should be the ones thinking through how this impacts the health system, how it impacts patients, how it improves or exacerbates disparities among patients, depending on their access to these tools. And so I think the more that we can educate and train the workforce, and the more that these national and international societies play a role in that for their membership, the more powerful it's going to be. We can have a voice then as clinicians in determining the course of many of these tools. I don't know about you, but every day, without exaggerations, every day there's an email, we have developed XX platform, and would you like to use it? Or would you like a demonstration of it? And we think it's going to be useful for you. And some of them are expensive, some of them are not. But the reality is we need to be equipped to understand what these platforms are doing and how useful they are or they're not. So that's just a quick glimpse on the other hat that I wear away from ATS, but definitely relevant, I think.
I mean, what you're saying about, the trainees or sometimes the attendings, I'm not that old, also not that far into my career, but even so now the trainees are saying, I've never heard that before. And they'll say, I got it from this X, Y, and Z platform that I know is an AI platform. And that's interesting. I always make a mental note to go and check that one out. But there's always my list just gets longer and longer. It grows faster than I can actually use these tools.
But the other problem is that we as human beings have a tendency towards, what's called automation bias. As soon as it's there for us on the computer or written down, we believe that this may be the truth. And the reality is, of course, we know there's a lot of problems with these platforms. There's a lot of good things, but there are a lot of problems as well. And so being able to not let the machine do the thinking for you, but you do the thinking while using these machines appropriately, I think is very important skill set.
Completely.
Let me just add, Eddie, maybe another aspect that I think is important, particularly in the context of ATA, the ATS being a scientific society. And that is the unique ability that we can use today tools that facilitate personalized medicine, more precision-based, both on the diagnostic level as well as the selection of targeted interventions. And so expose our membership to exactly how these tools operate, their pros and cons, the caveats that are associated with this, the critical settings that we need to impose and filters that we need to impose, not to become overly enthusiastic about it, but by the simple fact that understand what is behind the machine in order to understand how the machine operates. All of these are very important components that will make us better by being able to understand how AI can be a wonderful adjunct, but it can be also a terrible enemy. And in that context, particularly as it relates to research, we are talking today multiomics as if there was the very natural thing. Well, multi-omic pathways can be extraordinarily powerful and can define for a particular patient a specific genomic target or proteomic target or metabolomic target, and be able to intervene and show that this works is fantastic. But there can be also failures. And how to navigate this and how the machine learning that has gone, or the neural networks that have gone, or the LLMs that have been implemented in order to get to that result will actually dictate the quality of what we get. And that understanding needs to be somehow explained, presented, and continuously improved upon as we move through the society and we generate what I hope will be terabytes of data, petabytes of data that are very important to everybody, but at the same time have the limitations that I just mentioned. And so that navigation, we as a task force and the ATS as the leading scientific society in our field needs to really show the way to everybody else, and also make sure that we, in doing so, we do not lead anybody astray.
I think it really becomes important. Many of us already are seeing it within our electronic health records, that we have these clinical decision support systems that are multimodal AI that are actually using these variety of combination of natural language processing and machine learning and even LLMs already baked into the electronic health record. And as busy clinicians, even as busy researchers who may do clinical practice, there is very little time for people to sit down and think about whether or not this tool that has been deployed is in fact doing what it's supposed to or adding to your knowledge base or not. And I think it really is important. A good example of that was sepsis models that were introduced into a particular electronic health record in 2017 without actually testing external to the electronic health record. In other words, that kind of testing did not happen until 2021 for a particular sepsis model. And lo and behold, the tool really was not that useful, right? And so there's a lot of time and effort that goes into deploying these systems. So I think not that ATS's role necessarily is to evaluate every single tool that's out there, but to really give the society, the ability, and even the community to ask questions and check in with each other, and hopefully in the future collaborate on studies that validate some of these tools that are being deployed. I think that is a nice place to be as a society.
Yeah, no, absolutely. And I think both of you have highlighted a little bit of I would say maybe of even a friction between like traditional medicine practice, which is slow, and then an evolution of AI, which is a revolution. It's really, really fast. And so sometimes these things butt heads. So I don't envy the position that you are in, but I will look forward to what kind of solutions that you'll have for us for in the future, or guidance that you'll have for me. So, but I do want to turn a little bit to the future, and let's look at the near future. In I think maybe only a month or a little less than a month from when this episode releases, we'll be at the ATS International Conference. And my understanding is that you guys have things planned at the conference. What if I'm going to the conference, what kind of things can I be looking forward to?
And absolutely, it's not just us two. It really is a very talented group of individuals, and their names will appear on programming, of course.
Right.
We have many of our junior and senior members joining into and volunteering their time. The big picture right now for the conference is that we have what's called an ATS AI Innovation Lab that has a permanent spot in the exhibit hall. It has a very nice central spot, and all members can visit it during exhibit hall hours. In that space, we will have fun activities like trivia questions that ATS members can engage in, and just to sort of check their knowledge about various ATS tools. There will be presenters there as well from industry, not just talking about their product, but really talking about case use and hopefully evidence behind the use of their product. So that is definitely something that we're looking forward to. And then around that is workshops that have been developed by a lot of volunteers. And with the workshops, it's thematic, as I mentioned before. So on Sunday, the workshops will be around AI tools in education. And we have about 2-hour session. There's a nice room that people who are interested can go into that room, and we'll have demonstrations and use cases where our presenters will be talking about how they use these AI tools in their day-to-day existence, especially around the topic of education. On Monday, we're going to have the use of these AI tools in research. Again, we have a nice 2-hour workshop, and people can go in and see how people use these tools for the purposes of brainstorming around a research project, doing the background literature search, writing up specific aims, even analyzing data using some of the existing tools, without, of course, going into detailed statistics, but just showing how these AI tools can improve the workflow when you're thinking through the life cycle of submitting a grant, for example, or analyzing data from your research. And then on Tuesday, the workshop will be around the use of some of these AI tools in clinical medicine. So looking at some examples in radiology, which is obviously some tools are being deployed to aid in diagnosing in both chest x-rays and CT scans. We will look at ambient AI tools and how clinicians have been using it and the pros and cons of using these tools, and also these clinical decision support systems that exist, and just talk about, again, benefits and limitations. So it's really jam-packed. Most of these workshops are 2 hours. They're open to anyone, first come, first serve. But we're also streaming it to the exhibit hall in our location that I mentioned, which is the AI ATS Innovation Lab. So even if you can't make it to the room, you can catch it, and it will also be recorded and preserved for future use.
It seems like there's a lot going on. Is there I think I know the answer to this, but I'll just make sure. Is there a particular level of training that these workshops or tools or otherwise are targeted for? Or is this really kind of like everybody would benefit, or what kind of member, what kind of people are you looking to attract here?
Well, as a beginning, the purpose is to really, this is the first little anchor that we're putting within ATS, and we rushed to do it because it was so important. Things are moving so fast that we wanted at least to establish a little presence. This is really a little presence. We hope that this will fulfill 3 major expectations. One is that the ATS will start having an understanding and an awareness to AI across all its platforms. The second is that any member will be exposed one way or the other to the potential participation, learning opportunities of AI, and that we will see these areas thrive over the next few years, because they are clearly exploding everywhere else. So they're going to explode no matter what with us. So at least have them coordinated and integrated within the society. And the third thing is to hope that assemblies will take on leadership on their areas and start really developing the field so that they then are the content producers of the majority of the AI that the society can actually deal with. And so all we're doing is to putting a little bit of an enzyme and a little bit of substrate, and hope that the rest, the conditions, the exhibit hall, the enthusiasm of all the members coming to the conference, and those that can also watch it asynchronously, all of these will generate the kind of excitement and drive that will foster the development and propagation completely out of our control. That's the time that the task force will have fulfilled its role, and we will rapidly wade into the and disappear into the west and into the sunset. So really, the idea really is to minimize, to foster an initial surge, in get engaged and get engagement across all the society without any preconceived assumption that anybody needs to know anything. There's nothing better than a naive pair of eyes to look at things, because we have our biases and we carry our biases. And so a new pair of eyes that has never touched on it and says, well, wait a second, guys, this is bogus, or this is wonderful, and I love it because A, B, or C, which are the three things that nobody thought about. So that's what we hope.
And it
And
sounds
I
like I'm the perfect person for this, because everybody describes me as super naive. So sorry, Dr. Shafazand, what did you say?
No, you're not at all. No, you're not super naive. No, but I think the reality is that there probably is a little bit for everyone, even at the most expert level. I think if they wish to participate, it's going to be a workshop. And therefore, at the end or even during, there's an opportunity for the person who has a certain expertise to, even if they're not actively engaged in the initial content creation, to bring their perspective in and talk about their experiences. I think we will all benefit from that. So, but of course, the assumption is that we're coming in all as beginners rather than aiming for, super expertise level. There's also a lot of programming outside of this that's happening in AI. And if you actually just do a search on the program and just put in AI as the keyword, you will see that there are symposiums and keynote speakers and meet the professor sessions that are planned with ATS. And that, of course, is also going to be curated and shared during the AI Innovation Lab in the exhibit hall, so that people know where to go if this is an area of interest for them. And the other thing that I encourage is we will have surveys, and it's your opportunity for the society membership to give us feedback, not just on the workshops, but on the needs. What is of interest? What do they want to learn? So that for future conferences, as David said, either the task force or hopefully the various assemblies take on that challenge and provide the content and programming that is needed by the membership.
Yes, it seems like there really is a lot going on in the conference. But Dr. Gozal, you're talking a little bit about beyond the conference and moving towards the future. So what kind of things, or how can members, ATS members, community members get involved, or what can we expect beyond the conference, beyond a few months?
Yeah, that's a great question. There's several ways of looking at this. The first one is obviously within the range of assemblies and activities within each assembly. There's a variety of podcasts, of discussions, review of literature or publications, and so forth. So the assemblies can engage into deciding that they're going to take on AI as one of the topics that they would like to explore, and do this, and that level of cooperation and fostering of a more continuous interaction beyond the conference is what we hope will take place. The second is that this will foster projects within the society by membership to propose unique solutions to specific issues that would benefit, like, for example, from AI at any level, education, research, or clinical, and that can be implemented through the unique segues that are facilitated by the society. The third is that the society itself and the leadership through the assemblies, the board, and beyond will establish guidelines as to and a set of priorities for the society itself. Ultimately, without necessarily circumscribing them to a very rigid set of frame, but with enough guide as to what the society can provide and differentiate it from what memberships can do by seeking alternative routes to enrich the society or enrich their activities with AI. I hope that this is it reminds me a little bit of when, and I will tell you about my age. I was a physiologist and I started as the integrative physiologist. And at one point in time, back in the late 80s, I was told that physiology was descriptive and that I needed to start looking at mechanisms, and therefore I needed to do some degree of gene expression. Today we laugh at this because a single gene expression and some changes in an order or whatever we needed to do was clearly not mechanistic. But that was the impression then. I move forward 35, 40 years, and we find that we have now a very large complexity in the systems that we treat. And AI is uniquely poised to help us decipher those components. And I hope that by bringing AI to the membership and by bringing AI to the ATS can actually help in the processing of solving unique problems that facilitate exactly the missions that the ATS is meant to deliver. So that's kind of what I'd like to say.
Absolutely. And I think those are really good thoughts. I don't know, Dr. Shafazand, do you have any other kind of closing thoughts on this or moving forward types of thoughts?
No, well said. And Dr. Gozal, thank you for that. I think really the moving forward or closing thoughts is if there are members that are interested, I would really welcome them reaching out to myself or to David. And, while the members of the task force are sort of already determined because we have to have these subcommittees to make this happen, there is plenty of work to be done. And I think anyone who wants to be engaged or who wants to present or volunteer their time and their skill set to this endeavor, more than welcome. So please reach out and we're happy to connect with you.
Yeah, and even potentially we could leave some of the contact information in the show notes if we can get from you after the show.
Yeah,
I think I would like to thank everybody for joining us on today's ATS Breathe Easy episode. Please subscribe and share this episode with your colleagues. We've already mentioned the conference is right around the corner. Conference.thoracic.org today to register. Members get a discount on their conference registration, become a member, renew your membership to take advantage of the savings. But we will see you next time. Thank you all.
Thank you for joining us today. To learn more, visit our website at thoracic.org. Find more ATS Breathe Easy podcasts on Transistor, YouTube, Apple Podcasts, and Spotify. Don't forget to like, comment, and subscribe so you never miss a show.